Hello and welcome. Moss Adams is pleased that you joined us for today's session, Healthcare, Cybersecurity Risk is a Business Risk. Before we begin, I'm going to play a brief video.
Welcome, and thanks for joining. We're pleased to present our continuing professional education webcast series. Before we begin, please keep the following in mind. You can customize how you view our presentation and interact with the presenter. For better viewing, close all other applications and turn up your speaker volume. You can adjust window size and placement or enter full screen mode using the controls at the top right of the window or dragging the bottom right-hand corner to resize. At the bottom of your screen, you'll see a series of icons that relate to a different aspect of our session. You can download a PDF of today's slides from the Slide Deck and Handouts widget. You can ask questions by typing in the Q&A window and clicking Submit. We'll do our best to answer all questions or follow up via email. If you experience technical difficulty, refresh your browser by hitting the F5 key. Today's session offers 1 CPE credit. To receive credit, you must meet the National Association of State Boards of Accountancy requirements. You must attend at least 50 minutes of the session and respond to at least 75% of polling questions. To participate in the polls, please check the button next to your answer within the slide window and click Submit. We'll track your progress and alert you when you've earned CPE credit. You can then click the certificate icon in the CPE Progress widget and download your CPE certificate. Don't worry if you can't download your CPE certificate today. We'll email you a copy in 2 weeks. If attending this webcast in a group, you must complete our group CPE attendance sheet, available in our Slide Deck and Handouts widget to receive credit. Please have all group members sign it and send only 1 sheet per group. CPE credit can only be awarded to participants registered as themselves and isn't available for participants who view the on-demand version. This presentation is not legal, investment, or accounting advice. We encourage you to seek the counsel of a professional service provider to apply this content to your specific circumstances.
All right, and now I would like to introduce today's presenter, Troy Hawes, Managing Director here at Moss Adams. His bio and contact information is located in your webcast console if you would like more information. And now I would like to turn the floor over to Troy to get the presentation started.
Okay, thank you, Amy, and welcome everybody to our talk about cybersecurity risk and how that plays into an overall picture of the business and what the business risk practice should really be looking at when it comes to cybersecurity. Things that we're going to discuss today, we'll take a look at the current state of cybersecurity, talk through some of the cyber threats and risks, and what are best practices organizations should have in place. So some of our learning objectives today is really kind of take a high-level look at a number of statistics of what's going on from a cybersecurity posture in healthcare. We'll also identify how these risks become business risks. So there's a number of risks and threats out there that organizations are dealing with. So how do we then mitigate those? So what are those best practices for managing cybersecurity risk? With that, we come to just our first polling question. Amy, I'll turn it over to you.
All right, thank you, Troy. And before we get to this question, I do want to note that Troy's webcam is not working, so you can close out your media player and enlarge your slides, and that will allow you to see the polling questions and slides a little easier. But the first question is, how prepared is your organization to handle a data breach? A, very prepared. B, been there, done that. C, we think we're prepared. D, not prepared at all. Or E, not applicable. And as a reminder, to respond, you will need to click the button next to the answer you choose and hit Submit. Let me pull that back up. And we'll leave this up a few more seconds. Most have responded. All right, Troy, here are the results.
Okay, good. So the majority of people are definitely going to say we think we're prepared, because you really never know until you've gone through it. So those who answered B probably have had a data breach or cybersecurity incident and have had to really kind of identify how they progress and manage that incident and what's going on. For those of you that are not at all prepared, hopefully today's conversation will start thinking about what to do. And really that's the important piece is, well, where do we go? What do we need to look at, and what should we be doing? So with that, let's get into the current state of cybersecurity. So this slide provides a number of different statistics. These all come from the latest cost of a data breach report. This report is put out annually by IBM Security and the Ponemon Institute. Basically, they analyze and assess data breaches that have occurred worldwide and by various industry groups from the previous year. So this is really information from events that took place in 2021. And they really use this information to identify the cause of a breach and then the cost of the breach. And the main thing that they're really trying to identify and help provide is just information on what's going out there for various industries. So they've identified that the type of breach or the ones that are occurring the most are usually coming from a malicious attack. So somebody that's actually trying to attack an organization, or it was human error. And you can think of human error as maybe somebody in IT misconfiguring a firewall, or maybe they misconfigured a cloud setting, or maybe they just inadvertently sent sensitive data to the wrong person or to the wrong organization. So those are all kind of different ways that these breaches can potentially happen. So the middle section here covers a number of other statistics, and these are really around the costs of a breach. And costs are going to vary by industry, but healthcare has had the highest industry costs of a breach for 11 years in a row. And they've been doing this survey for, I think it's 17 years. I think this is 17. What you'll see on here is that healthcare data breach costs actually went up by $2 million. So in the 2021 report, when they're looking at 2020 breaches, the average cost is around $7 million. Now it's over $9 million for the average cost. These costs, and the way they kind of break these down, are basically costs from investigations or forensics of the attack, downtime or lost revenue, any types of recovery costs, and they've even taken in some reputational losses as well of what they've identified from here. Similar are the costs of ransomware breach that has an average total cost of $4.6 million. So whether it's another type of breach or just ransomware, these breaches, these incidents can cause major financial implications to an organization. The bottom section, we're going to cover this a little bit more, talking about the average number of days to identify a breach and the number of days to contain a breach. Actually, we'll cover this on the next slide. And the other thing is just the uptick in cybercrime since the start of the pandemic. So with people working remotely, all these new devices connecting over a VPN or different connections back to the organization, social engineering attacks being sent to personnel. When they are working at home, they might be easily distracted by other things going on. And just a 600% rise in cybercrime in general since 2020. That's a major factor, and one that the FBI is tracking quite a bit with all the different events that are going on. So when we're talking about a breach, and what we'd like to do is really kind of lay this information out. And some of this comes from different organizations, what they've identified, CrowdStrike, our own penetration testers, as well as more information from that cost of a data breach report by the Ponemon Institute and by IBM. So the first piece of it is what they call the initial breakout. Once they have something that they can exploit, so this is usually a malicious attacker, once they identify that and what they're able to compromise, they usually have that initial access within 2 hours, sometimes sooner. Then once they have that access, what they're trying to do is identify sensitive data. So that's a big goal for them, is to find any types of valuable information, and that's usually with sensitive types of data, whether it's personal information or protected health information, whatever that is, they're really trying to look for that. So that's usually done within 4 hours, and they usually have access to that within 16 hours. So they've been able to move laterally within their systems. They've been able to do other ways to identify really what's going on the network, and now they've got access to that information. Now what they found is that access sometimes isn't detected for over 200 days. So the attacker has this access. Maybe they've already moved on to another organization and no longer are within or doing things within this organization. They've got the data that they needed and have moved on. So now they're selling that data and making a profit off of it. But the organization doesn't detect this for over 200 days. And sometimes they're not the ones that detect this. Sometimes it's a bank or law enforcement that notifies the organization because fraud is going on, whether it's a fraud on a credit card or excuse me, identity theft, excuse me. And then it takes another 75 days to actually contain the breach. Oh, excuse me, 1 second. Sorry about that. So it takes then a number of days to actually remediate from this breach once it actually has happened. So it's a crazy timeline for somebody to actually have this much time on a network, and that actually has a name. It's called dwell time. We'll talk a little bit about this in some of our risk mitigation types of activities that can be done to really detect what's going on the network. So who's actually out there? Why are they doing this to us? Why are they after our information? Well, the main thing and the biggest thing is financial gain, and that's going to be your cyber criminal. They're really out there for the money. And any way they can do that, whether it's through a ransomware attack, holding your data ransom until you pay them, or it's somebody that's actually working for you. So we get the malicious insider, and maybe they're disgruntled in some way. And so these individuals then, maybe they want to make a profit, maybe they just want to cause harm to the organization. But that's another really kind of adversary that we have to watch out for. Also, basically what we call the inadvertent insider. So this would be like the person that sends data to the wrong person or the wrong organization, or maybe they fall for a phishing email and provide information. They fall victim to these. But those are the main individuals that are really attacking a lot of our healthcare organizations. The hackers, they're out there for the bragging rights and saying what they can do, but they may be a hacker, but really when it comes down to it, are they actually out there for financial gain? And maybe they're part of a criminal organization and doing other activities along there. And then there's the hacktivist or the cyber terrorist. Again, just motivated by different reasons, whether it's political, ideological, political. It really kind of depends on what they're trying to get across whenever they're going after an organization. Amy, I'll turn it back over to you.
All right, thank you. The second polling question is, what cybersecurity threats keep you up at night? A, ransomware. B, hackers breaking into my network to steal sensitive data. C, accidental breaches or leaks by authorized users. Or D, scammers posing as my employees to target our customers. And then as a reminder, if you would like to receive CPE for today's webcast, you do need to respond to at least 3 of the 4 polling questions. All right, Troy, here are the results.
Okay, and this is going to be different for everybody. Everybody has a concern. Maybe all of these. Maybe there should have been an E and all the above, because these could all be things that are something that makes you realize, hey, we've got to have cybersecurity in place, and we need to be thinking about it constantly, because that's the important thing. We really have to be keeping cybersecurity top of mind, and with that, how do we do that? What do we worry about? What do we mitigate, remediate first? So with that, let's talk about some of those threats and risks that are out there that our organizations are facing today. So some of the top threats that we're seeing out there, and it's not top attack vendors, it's top attack vectors. But these vectors are basically ways that a person can get access to sensitive information. It's really kind of what it comes down to. These are not in any kind of order, but they're all about trying to find a way to get information. So usually these vectors all share similar or similarities, because they're all trying to, one, identify a target, and trying to get information from that target. And that target could be a system or a user, person, things like that. And then they identify how that target uses information, and are there other ways to use that system or, again, person in ways that they could then exploit them. Once they've been able to exploit them, then they usually have some sort of access, whether that's through credentials provided, maybe they actually did a ransomware attack and encrypted data and made it unavailable until it's done, or they've just identified issues. We'll go through most of these in more detail. The bottom one, these cloud vulnerabilities and misconfigurations, these are the areas that we're seeing a lot of activity. And as more and more people moving to the cloud, or the ease of getting access to the cloud to store data, it makes it easier then for attackers to be always searching for these open areas, open ports, or open buckets of information. And when we talk about shadow IT, what this means is that with that ease of having data stored out in the cloud somewhere, then it makes it easy for any department in your organization to go out and use those cloud services. The issue is that IT or information security may not know that you're using that. And that could be an issue because nobody potentially has vetted that vendor, that cloud provider. And so there are potential issues with using that vendor. And that's really where shadow IT comes in, because now we've got our data going out everywhere. We don't necessarily know where it is. And if we don't know where it is, harder to protect it. So spear phishing, these are a social engineering attempt that comes through email. This is pretty prevalent. We've all been inundated with spam email. A lot of that is really just trying to find ways to get access or see if you will give up information. But it really comes down to somebody not being trained to really identify that is an actual attack that's going on, or somebody's trying to get information. Sometimes these campaigns are really well done. Other times they're real easy to see. But when an attacker is really trying to specifically test or attack an organization, then they're going to be very specific, and they're going to create more real-looking emails and try to attack an organization that way. And that's really where business email compromise comes up. So you'll hear BEC, back business email compromise, but it's really an exploit where the attacker either has access to an email account and then imitates that user's identity, or they're creating these spear phishing emails to, again, lure people into doing things. So these types of attacks have really risen in the way they've been done, because they're really more sophisticated in the way that they're doing these now. And so they'll make, you know, good email accounts and websites and things for trying to trick people. So like, for example, this false invoice scheme. So there was a healthcare organization that was doing a number of construction projects, and somebody got access to the CFO's email account, and was just monitoring all the emails and collected enough information about the construction company that they ended up sending invoices to the financial department there that were actually paid because they looked like they were invoices from that construction company. And they paid this cybercriminal over $1 million. And they didn't know that until the actual true construction company asked why they weren't paying their invoices anymore. So basically the person kind of became what they call man in the middle attack, where they were filtering out all the emails and being able to see what was going on, and then submit their own fake invoice to the right contacts within the accounting department to get it paid. Sometimes it's just as easy as that, as far as what they're trying to do. The other area we see a lot here is with this whaling and CEO fraud. So this really is where the attack makes it look like it's coming from somebody at executive management or board of directors. And again, it's trying to make people do something that they will do. It's really trying to make them, go pay an invoice or go wire money or give out information about employees. Like you'll hear W-2 being a large phishing attacks happening at the beginning of the year, and it happens quite a bit. In fact, Kaiser had a email compromise just the past 5 months, and they basically identified where they had over 69,000 personal data compromised. So it does happen, and these attackers get more and more sophisticated as these go along. And then there's ransomware. So ransomware been around for a while, but it's really just if an attacker finds data and then they make that data inaccessible, and basically they're holding it until the organization pays them. They're holding it for ransom. And there's just a number of statistics here, and a large number of healthcare organizations, especially since 2020, have been hit with ransomware. And healthcare is a good target for them because the systems need to be up and running. There are many stories where systems go down and doctors are doing things on paper, and because the EHR system is not up and running, or nurses don't know types of drugs the patient is taking, and so things just have to then slow down at a healthcare organization, or they're going to paper or doing some other method as a workaround when these systems are not available. So ransomware became a huge method for attackers since the start of the pandemic, because they knew hospitals were getting inundated with patients, and so they were impacting them in multiple ways. A lot of things that we hear is that organizations that actually pay a ransom, they're going to get it attacked again. Or if they pay, they don't necessarily get all of their data back. In fact, one survey out there where 61% of the organizations that paid, they only 2% of them actually got all of their data back. Most attackers will give the data back, because if they start hearing that the word gets around that they're not giving the data back, then people are going to stop paying. However, whether or not you get that data back and it's actually viable or will work is a different story, because once it does come back, how good is that data? Is it corrupted at all based off of what they've done? That's some of the things that we've seen with this. And then just the amount of recovery time once these attacks do occur. Anywhere from 2 to 4 weeks is kind of the norm that we're seeing for large scale events, just to recover all these systems, make sure that the ransomware is no longer out there on the systems. And then basic credential reuse or password attacks. Usually this is a big targeted effort where attackers may scour social media, such as LinkedIn, where they're searching for specific users whose credentials will give them access to critical data. And so they're really looking at those individuals that make sense for them to start trying to send them emails that will then get them to give up their credentials. A lot of times what these emails come in, it looks like they come in from IT, and there's always a, hey, you need to change your password and put your password in here, and we're changing this system, and we need everybody's password to make that change within the system. And or maybe it'll direct you to a website to input your password to make that change. And so if people are fooled to go out and do that, then they're capturing those passwords. So pretty easy for them to do that. And then the other piece with credential reuse is just the number of shared accounts. So it's sometimes easier to use shared accounts on systems where it's just kind of always logged in, but when somebody leaves, is that password changed? Maybe, maybe not. Or that system actually does get compromised, but you can't tell who was on the machine because you're not using a unique credential to get access. So everybody's using the same username to get access, and you can't really tell who's on the system. So there are definitely issues once you do have to do an investigation. And then just the impacts of COVID on cybersecurity. There's been decreased security budgets and the pressure to reduce costs or trying to do this. And that's as part of an organization and thinking about the financial piece of it. Yeah, those are things that may be necessary, but you really have to pick and choose those pieces. And a couple of other things, just the types of phishing protection that is out there. There's a number of different things that can be leveraged to reduce the number of phishing emails that come into an organization, and a lot of people aren't using those. And so implementing SPF, DKIM, DMARC, acronyms for big letter types of things, but they are good at really helping reduce the number of phishing emails that actually get into an organization. And Amy, I will turn it back over to you for this third polling question.
All right, so the third question is, how has COVID impacted your perspective on cybersecurity? A, it hasn't had any effect on how I view cybersecurity. B, it made me more aware of how quickly attackers will adopt new tactics. C, it made me more aware of how much my organization relies on our IT assets. Or D, it made me more aware of an increased risk when working out of the office. And while you're responding, if you would like a copy of today's slides, you can download them from the folder that says slide deck and handouts. And then we'll also be sending them via email tomorrow, along with the recording of the webcast. All right, here are the results.
Okay, thank you. And part of this question is really trying to understand if code has had any impact on cybersecurity. And some organizations know, some organizations are going to be even bigger impact. It's all based off of how you are already handling your systems, how cybersecurity was part of your organization, and kind of what that means moving forward. So there isn't a right answer. It's all about how your perspective is around cybersecurity in general, and then whether or not that changes, whether you're working remotely now or maybe you're not, but just what types of changes could affect cybersecurity in general. So our last section here, we'll talk about some of the best practices. This is a cybersecurity framework put out by the National Institutes of Standards and Technology. I'll refer to them as NIST. But they have built basically a best practices around cybersecurity for critical industries, and healthcare being one of those. And it's all built around these 5 areas. So identify, protect, detect, respond, and recover. And it's basically a continuous loop of identifying the systems that you have, protecting those systems, and then detecting activities on those systems. And then when you detect a potential issue, you respond to that. And then if that issue escalates to some sort of recovery aspect, then you recover those systems. And so it's just a continuous process, and each of these has very specific areas that I wanted to cover because they are good best practices. So first off, you need to identify what you have. So hardware, software, where is it, and what types of data either is being stored on that system or it's being transmitted through the system. So knowing all of these systems, whether they're on-premise or up in the cloud, we have to know everything that we've got. And then we need to do a risk assessment based off of those different asset types. So different assets may have different sensitivities. So one that stores protected health information more sensitive than a system that doesn't store protected health information. So from a risk perspective, we need to really then focus on a more sensitive system first. And so that's where we come into the protection pieces. So implementing logical or physical access control. So we're assigning permissions and users to this data, and it's all based off of some sort of need based off of their job responsibilities. We're doing security awareness training. So this is a protection mechanism and a very critical protection mechanism to help identify those phishing emails or phone calls or texts that you might be getting. And then we need to use different methods to then protect this data. So encrypting data when it's being transmitted and stored, very important. The use of multi-factor authentication. So having not only just a password, but something else that you're using to identify yourself as the right person that should be logging in to that system, whether that's some sort of biometric factor or some sort of PIN code. What you don't want to use is another password, but something else that's different than that. Network segmentation is very important because we're segmenting our systems. So our very sensitive systems may be in a network environment that's very protected and only allows certain traffic, and we're segmenting that off from others. Offline backups, so our backups not being encrypted during a ransomware attack and causing us delay in recovery efforts. So having these backups being in the offline mode so that it can't be encrypted at the same time as the primary system is very important. And then vendor management, making sure our vendors are secure. If they have personnel that have access to our systems, how are we managing those personnel? Or if we're storing our data in their systems, so like a cloud vendor, how are we ensuring that vendor stays secure? So having a good vendor management practice is critical. And then I mentioned dwell time earlier in our life cycle of a data breach. And really that comes down to being able to detect malicious activity. And this is an area that we find most organizations have a hard time with, is really having good detection mechanisms so that they're getting good information when some sort of activity occurs on the network or system that shouldn't be occurring, and then following up with that. So the detection category is probably where we see most of the issues and gaps when we're doing security assessments for our clients, because this is a hard thing to do. And sometimes an organization may have some sort of solution in place, but may be getting spammed from it because of all the activity that goes on. And so then they may miss something. So having some sort of monitoring tool that then alerts and identifies what's going on, that is a critical detection piece that we see all too often that is missing. And then response. So if we do get these incidents, how do we respond to them? So if we've got a good detection mechanism, it's giving an alert to IT, to information security, and then they should be then responding to that. So how do they do that? So the most important piece in this section is having some sort of plan, some sort of playbook that is followed for this. And a good example of that is just a ransomware playbook, so that you know who you're going to contact, what steps you're going to take for that system or systems, and who's responsible for what. And also identifying in that, would you pay or not pay for that ransomware attack? And that's probably going to vary based off of the system that is attacked and what you've got from a backup perspective. So having that playbook and the ability to respond then means you're going to be able to recover quicker, faster, and those response plans then tie into your business continuity and disaster recovery plans. So your business continuity plans really detail what the business is going to do to stay operational. Are there certain departments that can work off of paper if the electronic systems are not available? Great. So then what are those steps that they would be able to do that? And you document those. Where the disaster recovery plans are really the IT plans to recover the systems. So bring the backups back and do the restores of the data and get things operational again. So these incident response plans, business continuity plans, disaster recovery plans, these are all critical things to have, and then they need to be tested. So once you do have them, they need to be tested so that you know that they're all work or should work when something actually happens. And so this all kind of plays into it. We've got this defense in depth approach where we've got our target data, but we've got all of these things that are trying to protect this data, these systems. And this is really where it's critical to dive into all the different layers of different controls, whether they're policy and procedures, whether they're physical, whether they're technical, but they all play a role in this defense in depth methodology and process. And then the only way that we know that we have confidence in these protection mechanisms and controls is by doing assessments, audits against these controls. That way we're really validating that the controls are in place. Or if we have gaps, then we're going to do something to fix them. And so that takes us to the 10 things you do to combat threats. We've talked about some of these already, but 2 and 3 on here are critical, where you're having to harden and patch systems, really using good, strong security baselines for systems as they're brought into a production mode, and constantly updating these different systems where you can. Doing security assessments or social engineering assessments against your staff and awareness training. So having methods to frequently test personnel, systems, again, really trying to identify what can or cannot, or what is not working, and then what are we going to do to fix those. Cybersecurity insurance is a good tool as a risk mitigation. If you can afford it nowadays, it's really gone up due to all these ransomware attacks. But if the use of cybersecurity insurance is great, they've got good tools that can also be used if you are attacked and you have an incident, then they can be a good resource for you. And then the tone at the top for any IT governance, cybersecurity governance, we really need executive management to buy into this. So they should be going through the security awareness training. Oftentimes I see where the CEO doesn't go through the security awareness training. Yeah, they're a target, so they should be. So why not? So we really need that tone at the top be driven down where they're promoting cybersecurity and really talking through it. And Amy, take us through this last polling question.
All right, thank you. So the fourth question is, what area do you think represents the greatest opportunity for improvement in cybersecurity in your organization? A, conduct a security or risk assessment. B, security system or security team skill set improvement. C, management of a third-party service providers. D, employee training and awareness, or E, other. And once you've completed all your CPE requirements, you will be able to download a PDF of your certificate from the CPE progress window in your console. We'll leave this up for 5 more seconds to make sure everyone gets their credit. All right, here you go.
Okay. So thanks everybody for putting in basically what you think is your greatest need or where you think greatest opportunity to deal with cybersecurity. Any and all of these are, again, necessary and things that need to occur. The ranking of them is all based on your organization. So there may be other areas that are more applicable or things that need to be covered. But the main thing is, again, we're just thinking about cybersecurity and then implementing some sort of plan to address it. So with that, come to the end of the session. But a lot of the key takeaways that I want to get across is we need cybersecurity. We need the ability to secure our information in some sort of manner. And that is, from a financial perspective, that can be expensive. But we need this, or if we don't, we could potentially be breached, and that's even more expensive. Because as these data breaches happen, they're getting to be more and more expensive because the recovery costs are longer, or the systems are down longer. So really need to be able to recover systems quickly, really need to be able to get systems operational, because the attackers are not going to go away. They are constantly changing. They're becoming more sophisticated, changing methodologies. So trying to keep up with these attackers, it really takes personnel and systems to do that. And it's really pretty critical that this is an ongoing kind of, you can think of it as a maintenance activity, but really looking and addressing cybersecurity plans, your policies, your risk assessments, assessing how your systems are secure is really really critical with that. This other bullet here, where you hold business partners and vendors to the same standard of cybersecurity, that is also critical. All too often we see where these breaches actually happen with a third party that affects our data. And again, this third party having that information, having access to our systems, are those cybersecurity practices at that vendor, that service provider, greater than, better, worse than our own cybersecurity practices? So really diving into that, being able to audit their practices. So having a right to audit clause in your contracts with them, great way to help evaluate them. So there's a lot of things to do. And then kind of lastly, education. Education is critical. So I noticed that a lot of people said, we need to educate our personnel. I would say yes, you do. And it can't just be on that annual basis. All too often we see people, as they come on board, they may get security awareness training, and then a year later they get it again. It really needs to be top of mind at all times. So you should be getting information from your security team all the time. And hopefully they're sending out emails, letting you know what's going on, but keeping it top of mind will help keep them focused on that. So really think about that and how you're doing that piece of it. And then if you do download the PDF, in there are some good guides out there, some good information, especially around ransomware that CISA has put together. There's a number of ISACs, especially around healthcare, that are out there. And basically these are just information pieces to give or provide to talk through various ways of securing systems, or how to look at systems in a way that makes your systems more secure. So it's good, really good information. And with that, I don't think we've got time for questions. We're coming up on top of the hour. So Amy, I will go ahead and just turn it over to you. Close this out.
All right, thank you, Troy, and thank you for a great presentation today. And if any of you are having difficulties downloading your certificate, we will email out a copy within 3 weeks as well. And also in the upper right-hand corner of your console, there's an image that you can click to be taken to information on our annual healthcare conference, which will be in Las Vegas this November, so definitely check that out. And finally, here's a link to an online survey for today's presentation. And thank you for joining our webcast. We hope you'll join us again next time. Take care.